Good evening and welcome to another episode of Chronicles. Today we have the consultant of community medicine and the deputy director of preventive medicine and mental health services of the Army Hospital, Colonel Dr. Saveen Semage. Good evening, Dr. Semage. Thank you very much for agreeing to meet with us today.
Good
Doctor,
evening. It's a pleasure that I could join with you in this Chronicle 2020.
Doctor, I'm Omar Hazari and this is my colleague Yasitha Adikaramge. And we are representing the Royal College Red Cross Society. We are extremely honored to have you as our guest at Chronicles for today. For today's segment, we would love to discuss with you the current COVID 19 pandemic situation in Sri Lanka and the containment effort undertaken by the Sri Lankan government. Sir, would you please mind answering a few questions of us?
Yeah, it's my pleasure to answer all your questions. Yes.
Thank you, sir. Doctor, as you are a doctor as well as a military personnel, and we see that our country's triforces have been heavily involved in fighting the pandemic. Would you please care to explain how the military has set up the quarantine centers as from the beginning until now, please?
As you all know, that the military is leading the pandemic response, at least for the first 8 months. Our commander and the chief of defense staff, General Saveen Silva, has been appointed as the head of the COVID prevention task force by His Excellency the President. So we can see that the government has entrusted this. COVID pandemic response activities to the military. So we started with quarantine process in early February. Actually, our bulk of the work in the pandemic response was quarantine process and contact tracing as the military. And also we involved in some other works like locking down areas and then patient transport, testing, and all the other activities like treatment of patients, so and so forth. And we in the quarantine process, actually it was exclusively handled by the military, Sri Lanka Army doing the bulk of the work, and also Sri Lanka Air Force and Sri Lanka Navy has some portion of quarantine centers. So we started with the Wuhan rescue mission, where we got down our citizens from the Wuhan epicenter. As you all know, Sri Lanka is third or fourth country to do so after USA, UK, and Australia. Um, and that was a quite new experience for us, and it was on the job training for us also, because it has not been done earlier by us, not only by us, by the whole world. So we had very little time to prepare, only 2 days, and our engineers, they built up a new facility in Diathalawa Army Base Hospital, and it was done in 48 hours. And we had almost ideal conditions to quarantine about 34 people from Wuhan. And then we carried on that experience to the mass quarantine that we started on 10th of March at Kandekadu and Punani. So far now we have quarantined more than 80,000 people from overseas countries, as well as local contracts which we found in contract tracing from the local clusters. So we have been undertaking a tremendous task of quarantine process for about 8 months now. Our military medical teams and also the logistic and administration teams have been working in the field for long hours and in extreme conditions for this tremendous task.
Thank you, Doctor. Doctor, just a follow up question on your previous question. Could you please enlighten us on the Wuhan mission and how in Sri Lanka?
Yeah, first of all, the COVID task force was formed by the government, and then Wuhan mission was undertaken by exclusive by the military, and then we got together with the health to curtail the pandemic, and we carried on to the mass quarantine process, which we have been doing for 8 months now.
Thank you, doctor. How many quarantine centers do we have, and what's the total capacity of the quarantine centers in Sri Lanka?
So actually, we started with 2,000 capacity in early March. Now we have enhanced our capacity into more than we can go for 10,000 persons to be quarantined in almost 95 centers in the island. But Sri Lanka army is one of the best armies in the world, and now motto is nothing is impossible. So we can increase that up to any amount that we want if the need is there. As you can remember, when this the Minuangoda cluster started, so we had only 8,000 capacity, but we in within no time we enhance that capacity to 10,000. So if we have a necessity, we can increase our capacity with our logistic capabilities.
Thank you very much, doctor. What are the challenges you faced in setting up and running these quarantine centers?
Actually, we had many challenges because one challenge was the time factor, and also this was a whole new experience, as I said. We had that challenge because many people thought that we would have the quarantine centers, and there will be internal transmission inside the quarantine centers. And our primary objective was to contain the disease into the quarantine center. So we have 100% success on that. We have not anybody to go outside with the disease from the quarantine centers. Out of the 80,000, we had quarantine so far. So we had that. The other challenge that we had is to minimize the internal transmission. Again, we have succeeded in that. We didn't have any internal transmission inside our quarantine centers. Then the other challenge that we had to safeguard the frontline workers that who are engaged in the quarantine process. Again, we have succeeded on that. We didn't have any casualties during these 8 months.
Thank you, doctor. Doctor, seeing that the number of COVID patients are spiking each day, and if it continues like this, will COVID patients be asked to home quarantine?
So it's up to the government to take the decision with the consultation of the health authorities. So now, as you know, that the government has moved to take a decision that the people will be home quarantine, the contacts will be home quarantine. That was not due to the fact that we didn't have capacity. There was no capacity issues, but the government decided that. Their policy is that to home quarantine the contacts, and also but there was a new challenge for us that we had to transform our quarantine centers into the intermediate care centers because there was a treatment capacity issue in the hospital that we had. So we have transformed some of our quarantine centers into treatment centers very recently. So we are continuing to help the health authorities to get all the patient into the hospitals and treatment centers with the increase of COVID positive patients.
Thank you, doctor. In the current circumstances, seeing that some of the cases were reported pool were from the people who were repatriated from other countries, do you think that allowing international travel is a good idea? Or should we wait till the situation calms down a bit?
Well, that they are our own citizens. So we have been doing repatriation process for a long time now from March, and they all were quarantined actually. And now we had to stop repatriation for a little while when this Minuangoda cluster started. But we can't go for a long time without getting our citizen back to the country. So now the government has decided to restart the quarantine process, and but in a manner that it will not be a burden to the treatment capacity and the testament capacity in the country. And we also know that there have been a lot of measures that have been taken in order to facilitate the repatriation forces to resume back. So one example is now they are getting their tests done before they leave their destination. And also we have all the measures that from the military side in the airport, all the precautionary measures, and also in the quarantine centers that they are well looked after, and to make sure that it will not be a burden to the country.
Thank you, Doctor. The second wave of the COVID pandemic is ongoing and it isn't showing any signs of slowing down. Do you think that reopening schools during this time is a suitable idea towards the current situation?
Well, now we have to see the dynamics of this epidemic. So, if you take the distribution of this COVID 19 positive patients, we see a huge concentration into a part of the Colombo district, especially in the Colombo municipality area. And also, it's again in the Colombo municipality area, it's restricted to a certain part. So even in the WHO new guidelines, they say that when you talk about the staging of the pandemic, it's better to consider the geographical distribution of positive patients. If you see the distribution in Sri Lanka, we have a lot of places that is COVID free. So I think now we have to consider all these facts, and we have to think of running the country as new normal without going for a protracted lockdowns and isolations. So, with all the precautions, the health guidelines, I think we can start schools, and at least in some of the areas, most of the areas in the country. And because we have active epidemic going on in the Colombo municipality area and the suburbs, we will take some time to restart the schools in Colombo area. But at the same time, it's the responsibility of the students to follow the guidelines, to adhere to the instruction given by the health authorities, so that we can keep the schools open. Otherwise, what will happen that then again a decision will come that we have to close the schools if the things go wrong. So it's the responsibility of the school children as well as the teachers and the parents to see that the schools are functioning without any COVID threat inside the schools.
Thank you, Doctor. With that being said, I would like to hand down the next set of questions to my fellow colleague Yasitha Adikaramge. Over to you, Yasitha.
Thank you, Omar. So, doctor, moving on to my question, what are the measures that will be taken if a patient escapes the quarantine center?
We will not anybody to escape from the quarantine center as long as the military are running the quarantine centers, and it has not happened so far because we have our own security, our infantrymen, they do the security, so there is no chance that anybody to escape from the quarantine centers. It's happened from the hospital, as you know, in one or two occasion only again for the last 8 months. So your question, what happens when if a person escape from the quarantine centers? The first thing that we have to do is to find out this person, We can do that with our intelligence capabilities and our infantrymen. So we will find him out as soon as possible and take him back to the quarantine center. And we are the not the one who has to take action against this violation of law, quarantine law. So it is up to the police, because it's a military usually does not involve in civilian matters. It is the police who take action against violation of the law of the country. The law of the country regarding quarantine is the Quarantine and Disease Control Act, in which has been enacted way back in 1897. So it is still valid in Sri Lanka, and there had been new gazette notification to strengthen the law in Sri Lanka. So the police will take action according to the law. But we have some other measures to take, that we have to do contact tracing to find out people who have got contact with the escaped person, and they also will have to be quarantined or isolated to see that the disease is not disseminated into the society.
Thank you, doctor. Moving on to my next question. In the events that a third wave hits, do you think that we would have sufficient care centers?
Okay, as I discussed earlier, that even in a third wave or any other wave, that Sri Lanka Army is capable to rise to the occasion, and we think that first of all we have to control the disease to a certain level that Sri Lanka can manage with the treatment and testing capacity. So even if not, that the Sri Lanka Army will have the innovation and the initiative to cater for the need that will arise from any wave in future as well.
Thank you, doctor. Moving on to my next question. When a person arrives abroad, some people are allowed to pay fees and stay in hotels. Is this effective for the containment of the virus?
No, because even they are at hotel or in a government quarantine center run by the military. Actually, both are run by the military. So they we take it as a quarantine center. Only the place is different, but we our rules and regulation and the way that we do the quarantine is same, whether they are in a hotel or a government quarantine center. We have our doctors in the both places, the medical staff, the security staff, the logistics staff. So we run the quarantine centers in hotels as well as in government centers in the same manner, that people who come to the quarantine centers have to undergo the same kind of quarantine process under the military. So there is no difference, but allowing people to go to the hotels, the advantage that we have is that because we have very limited quarantine center capacity in the government sector, so we can take more people into Sri Lanka, especially from the Middle Eastern countries who had lost job, who can't afford to go to hotels. So they can be accommodated in the government quarantine center, as same time that the other people who can afford can go to hotels. So we can bring more people if there are people who are willing to and afford, who can afford to go to hotels. So then so there are about more than 50 to 60,000 waiting to come to Sri Lanka. So our objective is to get everybody to Sri Lanka as soon as possible, and try to finish the backlog. So I think hotel quarantine is assisting in that objective.
Thank you, doctor. For the next few questions, my colleague Omar Hazari will be taking over.
Thank you, Yasitha, and thank you, Doctor. Doctor, we see that there weren't any COVID patients in the public for several months until the 4th of October, and all the cases were reported from quarantine centers. How did the virus get into the public again?
Okay, now this pandemic is worldwide, so no country can escape from getting the virus into the society, in my belief. So, but we had good control for a long time. That is because we had the political leadership and also the military involved, the the strong health sector. There are a lot of factors that contributed to that control for a long time, for 8 months, where many countries failed, even the developed countries failed in the initial state. But now we have a situation, but we don't think that it is going to be there for a long time. So when a case or two leaked into the society, this can happen. But our system is strong enough to pull back this and have a control over this situation. um, I think when we do this kind of a massive operation in a pandemic, there can be some leakages uh, from due to many facts, because we had three clusters earlier than this, earlier to this, and what we have seen, that there can be outliers uh, who can show their disease in a hidden manner, and for a long time, that we quarantine people for 14 days, and there can be testing failures that is embedded in the testing by nature, that any test is not 100%, so much so that even the PCR is only 70% sensitive. So there can be system failures like that. So even one case leaked into the society will make a big cluster. So that is what has happened in Sri Lanka. But we have the system in place with the health and the military, that they are doing their best to get the situation under control. As you can see, now we had the Brandix cluster, so it is almost controlled. We don't have any patients in the hospitals, maybe very few, about 50 patients out of 300 3057 cases from Minuangoda cluster right now. So likewise, even the Paliagoda cluster will be taken into control by the pandemic response authorities very soon. So then we can have the new normal again. The people can enjoy the new normal again. But it's up to the people of the society to assist the health authorities and the military and other partners like police to get this situation under control. All depends on their behavior, actually, and the discipline. So if they stay home when there is a threat, and they follow the health guidelines, if they wear mask, they keep the physical distancing or the social distancing, so that will help the authorities to contain this cluster. So I think any country can have this kind of hiccups time to time, but Sri Lanka has done well during the past, and we have that all the capacity, the capability, the political leadership by the His Excellency the President, then by the commander of the army, who is the head of the COVID task force. So we can pull back this and have the control, I think, but it depends on how the society behaves.
Thank you very much, Doctor. Doctor, when areas are under isolation for a long period of time, how do they how do their basic necessities such as food, water and other needs get fulfilled?
So usually the government is assisting for the people in the isolation areas. There is a mechanism run by the government under one minister. They are getting the assistance from the government, as well as they are getting the monetary assistance from the government. And there are some NGOs. Then as military, we also assist these communities to run their day-to-day life. But the aim should be that to lift the restrictions as soon as possible by controlling the clusters in these isolated areas. So it has been happening, I think. Now, if you can remember when the Binuangoda cluster started, we had whole Kampaha district under isolation or lockdown. But now it has been released, and gradually the lockdown areas are being released by the government. If there is a necessity, only the government policy now is that there will be very minimal restrictions or isolations in the country. The people were talking about a complete lockdown, but that never happened in this cluster. So I think Sri Lankan government is in the right direction, that they have the right policy to in isolation for a short period of time and lifting the isolation, and trying to maintain the normal day-to-day life of the people in this country. That is really important, because uh, for the health people like us, it's really easy if we have a complete lockdown. But on the other hand, for the community, it's going to be not really easy when there is a lockdown. Especially the poor people like daily wages, they will the ones they will be the ones who are suffering most. So I think right now the government is assisting, and they have the mechanism to assist people who are in the lockdown areas.
Thank you, Doctor. Sir, can you please enlighten us on how the army during contact traces COVID-19 victims, and how they do it so efficiently in such a short period of time, please?
Yeah, Sri Lanka is a country which has a unique way of contract tracing. I will call it hybrid contract tracing, because we use in Sri Lanka two different modalities to do contract tracing. One is the public health surveillance system that we had in this country for a long time, for about century, and we are using the military intelligence for contract tracing. So we have this hybrid system working really well in Sri Lanka. We have used the state intelligence services as well as Sri Lanka Army intelligence services in par with public health or health surveillance system in Sri Lanka, and it has worked really well. That in Sri Lanka we do the contract tracing up to third layer. I don't think many countries can do that, even the developed countries. And there had been a lot of technical or the technology is being used in contract tracing by the military intelligence. So that is why the contract tracing has been very successful, and even WHO has recognized Sri Lanka as one of the countries which has a very good contract tracing system in the world. And that is why we could control the disease, and find out cases very early. That is why the deaths are minimal in Sri Lanka, because we identify cases very early in Sri Lanka, so they don't go to complications. So contact tracing has been a highlight in the pandemic response in Sri Lanka.
Thank you, Doctor. Doctor, in many countries we see that the hygiene and nutrients are not up to mark in the COVID centers. In Sri Lanka, are the needs fulfilled in these quarantine centers?
Well, I think you have heard the story from the people who have been quarantined from their mouth. So we like to get the feedback from the others, not boasting about what we have done to the country. So they came out and told their story to the whole nation when they underwent the quarantine process under the military. Uh, we know that there was a hiccup on the start. That is because they didn't know what we are going to do. They thought that because the army is involved, that it's going to be a kind of entrapment or keeping them by force. But we never did that. Actually, we had all the facilities in place for the people who were quarantined. The basic facilities, they were up to standard. There are WHO guidelines how to what are the facilities that we have to give in quarantine centers. So we adhered to that, and we did more than that. And there were welfare facilities like Wi-Fi, then other entertainment facilities. Then we had a system of health education to communicate with them in various ways with addressing systems, with videos. We had the televisions and in their all the places for them to watch their news, and we delivered our health messages through those televisions. And we had a lot of welfare facilities given to them, and we actually provided them the best that we can provide it with meals, and the other things like washing machines, hot water facilities, uh, uh, many things like that. So people who were quarantined in our quarantine centers were really happy when they left the place. So I think you have seen how some of the countries have done it with minimal facilities. But in Sri Lanka, by the military, we have been able to do our best to give the best to the people of our country when they were subjected to quarantine. And that is because the military has the logistic capability to do things in a short time period in proper manner.
Thank you, Doctor. Doctor, would you please mind explaining to us the difference between the ordinary quarantine process and the home quarantine process?
Okay, in the government quarantine or the institutional quarantine process, that we take people from their own place to a strange place. So invariably, the people will not like to go to some other. But there were instances that people voluntarily came to government quarantine centers because they knew that the self quarantine can't be done in their houses. So the difference is that people can stay home if they are self quarantining, or if they are subjected to home quarantine. The problem with home quarantine is that it is really difficult for the government to sustain their basic needs for 14 days, and also the people who are quarantined can't find themselves the basics need for 14 days. They find it really difficult. But when they are taken to a institutional quarantine center, they will be provided with all the basic needs and other support by the military. So that is the main difference. But on the other hand, in the home quarantine, they are at home, they are very comfortable in their place. But if provided if they have enough spacing and enough facility to be home quarantine. Now the government policy was to have 100% institutional quarantine until this Minuangoda cluster. Now the policy has been changed that the people are quarantined at home. So home quarantine is the policy now. But as I said, there are places that we can't do home quarantine, like flats or slum areas, and there are people then when they have their elderly parents at home, they are willing to come to a institution quarantine. So the military still has have to run the quarantine process to cater for these needs.
Thank you, Doctor. Doctor, what exactly happens to all the COVID victims who pass away in the quarantine centers, of course?
Last month, but most of them are elderly patients with comorbidities. So some of them were found COVID positive after they died due to some other illness. but before that, the deaths were very minimal. What happens in isolation area, death happens. It's up to the health authority to handle deaths in Sri Lanka. So they what they do is that they do a PCR. If they think that there is a, possibility that or there is a contact history for the deceased person, they will do a PCR to confirm whether it is a whether the deceased person had COVID or not. So if it is a COVID death, if it is declared by Director General Health Services as a COVID death, the Sri Lankan policy right now is to cremate all the dead person due to health reasons. Even if it happens in isolated area or in a hospital, the procedures are the same.
Thank you, Doctor. Thank you, Doctor. Doctor, just one last question before I hand down the last few questions to my fellow colleague, Yasitha. Doctor, could you please tell us who should wear PPE during the situation which is ongoing, and what type of PPE should the fellow citizens wear?
Even a mask is a PPE, the gloves, and there are various kind of PPEs. So I think you are referring to the full PPE that people wear, the white kits with goggles and all the full PPE. That is, of course, for a specific reason to wear. You can't wear it the whole day and expect to get yourself protected from COVID. So always the full PP is for a specific uh, purpose. Like if you go to see a patient, you wear it, and when you come out from the ICU or the ward, then you have to properly remove it. So that is how the PPE should be worn. But for the general public, before that, there are various kind of PPEs that are recommended for the various purposes. So for the general public, what the WHO recommends is mask. That only the mask, no other PPEs should be worn by the general public, because they don't have any requirement to wear other PPEs. That is for the frontline workers to wear that PPE. The wearing mask, again, there are many kinds of masks. But the best masks are reserved for the health workers, because it's a rare commodity in the world, not only in our country. So what is advised is to wear at least a cloth mask. If you can get hold of a surgical mask, that is better. The best one is the N95 mask, but because it's a rare commodity, it's always reserved for the specific purposes. So general public, the main PP is mask, but they have other things to do, like washing hands and keeping the physical distancing. So that's how they can get safe from COVID-19.
Thank you, Doctor. With that being said, I would like to hand down the last few questions to my fellow colleague Yasitha Adikaramge.
Thank you, Omar. So, doctor, what do you think would happen to people who live out of a daily income source? Is the government doing anything to help them?
Yeah, that's why now the policy has changed. That now we are in the mitigation phase. Now we are not in the containment phase, because we can't go on by locking down the country. That will affect the economy very badly. So now the government is not going to go for lockdowns. There will be limited isolation to control the situations. But with this pandemic in the world, there had been a lot of economic consequences. So the daily wages have been affected very much. but the government, as we all know, is trying its best to help them out, and also by keeping the country open. That is the duty of the healthcare workers and the military to fight against this COVID 19. The objective is to keep the country open as much as possible without going into lockdowns or isolations. So that is the way that the government can help the daily wages by getting the economy moving, by keeping the country open is the only way that we can help the daily wages. On the other hand, the normal citizens of the country also can help the daily wages by helping them by buying things from them. So those things should be taken into consideration in future with this new normal, that to help out the self-employed people, try to have charity works, how we can empower these self-employment people from the government. There had been loan schemes introduced to help out the self-employed citizens of this country. So there are many ways and means that we can get together as a community, as a society, to help the poor people to come out from this economic constraint which has been created by the COVID 19 pandemic.
Thank you, sir. I'll be moving on to my next question. Doctor, you started that in state run quarantine centers, basic necessities such as food and water are provided by the government. Wha- What about the people in self quarantine? How do they get food and other necessities?
So, as I said, that the main aim of the government is to limit the isolation and lockdowns as much as possible. When we have the lockdowns, there is a mechanism of in the government to help out to the people in the quarantine or the isolated areas. There are mobile sales outlets for groceries, and there are mechanisms to provide ration and money for these isolated families. And yeah, so and there had been lifting of sorry, lifting of the isolation time to time, as we experienced in the past, but it has failed, I think, because the Sri Lankan citizens did not use that opportunity really well. They were not disciplined to do that. Now we don't have that intermittent lifting of isolation, so it's a continuous isolation if a area is isolated. But the government, the police and the military, they take action to provide the assistance in daily life to the isolated person in the isolated area by providing the ration money from the government uh, as allowances to the citizens.
Thank you, doctor. Moving on to my next question. Do you have any advice for the public during this truly disastrous time?
Actually, the public should behave responsibly. That is the only way that we can get out of this tragedy, as you said. The government, the military, the police, the health sector, all are trying their best, and they have sacrificed their time, their family time, all their other works to this to help out the people of this country to get out of this pandemic, or to control this pandemic. And they have taken all the risks, even risking their lives, and risking to get the disease themselves. So it's the duty of the citizens of the country to act responsibly, and try to help out the authorities, the frontline workers, to maintain the new normal in the country, to maintain the normal day-to-day life in the country by acting responsibly, like wearing mask, keeping the physical distancing, and to minimize the amplifying events like many events that they and to organize, and then to do the simple basic health habits like hand washing. So that is the only way that we can get out of this tragedy. So I appeal to the citizens of this country to help out the frontline workers to control the disease by acting responsibly.
Thank you, Doctor. Thank you, Doctor, for taking time off your busy schedule and sharing knowledge with us.
Okay, thank you for having me on your series of chronicles, and thank you for giving me this opportunity. Thank you very much.
Thank you.